Ladies and gentlemen, welcome to the Studio 88 podcast. I'm here with my good friend, Dr. King, Faisal Rehman, again for the second time. Welcome, my King.
Thanks for having me, Jamie. It's always great to be here.
I know with, in the middle of a pandemic and things are a bit crazy. And I reached out to you and I know it was a hard time and it was hard to get you in because everything, the social distancing thing. Now things are a little bit kind of let loose a tiny bit. So I thought I wanted to bring you in so that we can discuss COVID-19, the coronavirus, and your take, your frontline worker. You see this at the hospital. I kind of want to see your perspective.
Yeah. So, it's been 100 years since our last pandemic, worldwide pandemic. And it was a scary time. As you know, this all started in Wuhan, China. And initially, I would say most of the world was slow to react. And part of it was we weren't aware of how virulent this organism was. COVID-19 is not necessarily the most deadly virus we've encountered in the past. The mortality rates actually overall are low, but what makes it such a problem is it's very transmissible, very, very transmissible. And our vulnerable the vulnerable people in our population are very prone to severe manifestations of infection. So our older patients in particular, or patients who are on immunosuppression who have compromised immune systems. And so it quickly became evident that even though COVID-19 wasn't as deadly, let's say, as SARS, or as deadly as some other viruses that we've encountered in the recent past, because of how infective it was, so many patients were getting it. And even if only 1 or 2% of those patients were getting severe manifestations from it, it was a huge number of patients. Mm-hmm. And so, the world was slow to react. And then when it started hitting other parts of the world, it became very scary. We've trained a lot of doctors in the world in our center from Italy and from other countries. And one of my colleagues was talking to the nephrologists in Italy, and it was just a disaster there. An older population living in close quarters. The infection spread like wildfire. And there were times where they were running the same breathing machine for 2 or 3 different patients. They were having to move the ventilators. And people were unfortunately really dying and suffering a terrible amount. And the healthcare system became crippled immediately. Mm-hmm. And so as the infection started migrating towards us, that became a very, very scary thing. Mm-hmm. And thankfully, our government took it seriously. Our health agencies took it seriously. And in March started really educating the public on social distancing, on the utility of wearing masks, on not touching your face, on frequent use of hand sanitizers. And, it's a testament to the Canadian public that they listened and took it seriously. And I think for that reason, we were not hit as hard as some other countries. I mean, look at right just south of the border what happened in the United States. Mm-hmm. Over 100,000 people are dead because I'm just saying bluntly, many of them did not take it seriously. Mm-hmm. Businesses did not close. The casinos did not close. And I said that because I was in Vegas just before this outbreak happened.
Yeah, because you went to Vegas after the last event.
Yeah, and so I was there before all of these announcements had started, and just before. And you know what? I'm glad I got back. I'm glad I didn't contract the infection in Vegas because a lot of people in Vegas were infected. And so I was in quarantine for 14 days. As soon as I touched down, I didn't see anyone or meet anyone. And then I was able to go back to work and start taking care of patients. But this was the real deal, just for everyone out there. This was the real deal, and I think Canada acted appropriately. Mm-hmm. It came at a huge cost, though, of our small businesses, who are suffering tremendously from this. But I think it was necessary, because otherwise, especially in our older patients, we would have had a catastrophe, and our hospitals would not have been able to carry the burden. Mm-hmm. We were so worried about what was going to happen. We were going to take over Western Fair and open a 2,000-bed facility in Western Fair. I
actually saw the setup. So actually a friend of mine's brother did the setup. Yeah. So Western Fair was completely converted. It had, I think it was 200 plus beds or something like that.
We were going to have it equipped for 2,000 beds.
2,000 beds, that's what it was. Yeah. So, I mean, that's scary, man.
Scary stuff. So I really want your listeners to know that this was not overplayed. Lots of people have died. If you go to any of the hospitals in New York, the emerge docs were basically in tears. They couldn't keep up with what was happening, and then the infection rate among the healthcare providers was so high. So the whole system was in danger of falling apart. And because we operationalized social distancing, closed down businesses quickly, discouraged public gatherings, discouraged travel, frequent use of hand sanitizer, masking, and all that stuff, it's made a difference. In London, I'm very familiar with the numbers in London. We peaked at around 40 patients at one point that were admitted to hospital, COVID-positive patients. And thankfully now we're down to 8 patients. And I think it's a testament to our citizens who really cooperated with public health recommendations. In countries that didn't cooperate, you can see what happened. Just look south of the border, a disaster. And the disaster is because of disastrous leadership right from the top down to the whole system.
I mean, a lot of people will argue this. I mean, there's a lot of people at home that are going to say, well, why would you crash the economy for it? Why would the numbers are so low? Why aren't we out working again? How come we're not full steam ahead? Everybody's been affected by this, and the mental health issues I see from it, from being in quarantine, from losing businesses, from losing work, people losing houses. Like, at what point, like, in your professional opinion, how long do you think this will actually go on?
Yeah, so great question. So first of all, I think what we had to do in March until now was absolutely necessary. And I think it saved countless lives. I think what makes Canadians different from others is we really care about our vulnerable population. We care about our older citizens, and they're the ones who would have suffered the most. Don't get me wrong, young people die too from COVID-19, and that may have even been a major issue if we hadn't done what we did. But we're protecting our fathers and our grandfathers and our aunts and uncles from dying 100%. And so it was an absolute necessary thing to do. But don't get me wrong, it's heartbreaking for me to see what happens. I went into my dry cleaner the other day. He's a beautiful guy, hardworking. He recently bought the dry cleaning business from another owner just before this all happened. And I went in there and he looked very upset, and I dropped my stuff and I said, "Is everything okay? You don't, what's going on?" He said, "My business is down to 10% of what it was. My landlord is not going to let me have my rent off for a month just so I can recover. He's forcing me to pay the rent, and I feel I'm going to be ruined." And, I appreciate Doug Ford coming down on the landlords hard, but he's not able to enforce this rent forgiveness or rent delay even. And so he's falling apart right now. His business is still at only 10%. He has to close one of his stores. I went to Cora's for breakfast here in London, at the one in the North London, and the owner came up to me and said, I was just getting breakfast for takeout, and he said, "I want to thank you for supporting us. This is just destroying me. I'm not sure how long I can keep it open, but I appreciate every customer I get." And in that huge restaurant, he only had his wife working and one worker who was helping with the transactions, and he couldn't afford to have any other workers, and he had to lay everyone off. So people, don't get me wrong, we need to take care of that issue, because people will suffer if we don't take care of our small business owners, and they already have. Many of them have gone bankrupt. So we are now getting to the point where we need to start slowly opening the economy and doing it in a cautious way. And because you're right, it's such a horrible balance. On one side, you're battling life or death to some degree, but on the other hand, we can't underestimate. People are dying probably from poverty and from depression and from not being able to provide for their family. And when you lose your business, like, that's just devastating. So I agree with you. I think now is the time where we need to start to open the economy. And the government's doing its best. Like, how do you do it? How do you do it in a planned and a careful way? And the reason why I think the public, and myself included, are frustrated at times is the message keeps changing. And even in the hospital, the message kept changing in terms of, okay, we have a shortage of protective equipment. You can only use one mask a day. Okay, it's a little bit better this week. You can use, you can be more for this type of procedure. You can wear an N95 mask, but not for that. And it kept changing and changing. That was very unsettling for us. But the fact of the matter was we were learning as we were going. We were learning from the China experience. We were learning from other people's experience. So it's been even though it's at times it probably seems disorganized to the public, I think the public health people are doing their best with the limited information they had. And now when it comes to the economy, we need to open it up for sure. We need to be prepared for a second wave, not be terrified of it, but be ready to jump on it.
Because that's what I was going to ask you is do you think there will be a second wave?
If there is one, I'm praying and hoping. That's not facts. I'm praying and hoping that it will be a limited one because I think we are so sensitized now we can jump on it quickly. So everyone thinks there will be a second wave. But how impactful will it be? We don't know. I think it'll be very interesting to see what happens in the States because they opened their economy very aggressively, right? And so they've already had 100,000 people dead. The question is, by them being very aggressive and more aggressive than opening the economy, how will it impact their second wave?
So what do you feel about herd immunity?
So I'm all in favor of herd immunity. So herd immunity, just for your listeners, is where, if you have chicken pox, you put all the kids together, they all get the chicken pox.
We did that as kids. Yeah. There was a kid in my building. My mom was like, come with me, you're going to go play. Yeah. And I'm like, why? He's got chicken pox. Yeah, exactly. Yeah. Let's go.
So the problem with doing that and just is that people will die. You don't tend to die from the chicken pox unless you're immunocompromised. You will, our older patients, grandma and grandpa will die or have a high chance of dying from this. So I think to just say, let everyone mingle with everyone and survival of the fittest, we're going to compromise our people who are prone to the severe manifestations.
My mom.
Yeah. And so we need to care about our older. When I'm 70 or 80 years of age, I'm hoping my government will and my family will think of me when making any decision. And so, all of our older citizens, they paid taxes, they worked hard, they deserve the protection. And just to say, to be cruel like that and callous like that and say survival of the fittest, because that's what people mean when they just say just put it all out there and get it over with. That's what's going to happen.
Well, I've heard put it out there, get it all over with, but quarantine the weak. Not the weak per se, but not the weak. The more
vulnerable people.
Yeah. Vulnerable.
And you got to be careful though, because look where all the outbreaks have happened, right? Even when we're being careful in the nursing homes, in the retirement homes, that's where people have gotten these infections and become super sick, right? Despite how careful we're being. So imagine you're not being careful, and you think it has to happen. Everyone has to play a role in protecting our citizens.
You almost think it would have been better for them to completely lock everything down for 2 weeks. As soon as they got caught wind of everything happening, suspend all flights. Nobody's allowed to leave your house. Stay home for 2 weeks. Send out task force to feed people if they run out of groceries. But nothing. Like, you can still go to McDonald's and order French fries. You still go to get a coffee. It's still kind of careless and prolonging that curve.
Yeah, hindsight is 20/20. I can say compared to other countries, I think Canada has done a pretty good job.
I think they've done actually a great job because our numbers are really good. I think it could be better.
Yeah, and we are lucky in the sense that Canada's a huge country that's not densely populated. That helps. But I still think our government acted as responsible as they can. Hindsight's 20/20 in terms of what we could have done, what we should have done. But I think compared to what other countries in the world have done, I think we've done a pretty good job.
Now, moving forward, how long do you think it's going to be before we can have public gatherings again?
Yeah, so this is a big issue that I'm dealing with right now, actually, at the university level and in the hospital where we take care of patients. Right now, in the hospital setting, we are not allowed to have more than 5 people in an enclosed space. And it doesn't matter how big that enclosed space is. So it can be the size of a football, well, I'm exaggerating, but like a huge room.
It's an auditorium.
And an auditorium, but we still are not allowed to have more than 5 people. Now, we're trying to get that changed because when we're taking care of patients, we depend on working in a team environment. And to have, we half of the team not in the room and half in the room, it's going to cause inefficiencies and could potentially compromise patient care. So, and to do Zoom meetings and all that is not easy either in a hospital because there's only limited numbers of computers and such. You can't even really do that. Also, nursing students and medical students are returning to the hospital. They need to be accommodated and need to be taught. And to have 5 people in a room is just not going to work. So we're working on trying to increase that number, but doing all the proper safe things, which is masking and frequent use of hand sanitizers, etc. And if you are sick with a cold, you stay away, get swabbed, and you stay at home until the symptoms
I think
resolve.
my wife's dad had it. We totally, wholeheartedly think he had it. Like he had the fever. He had every symptom there was. Really weak, but being an older man, he didn't want to go to the doctor. Didn't get tested. He just quarantined. He self-isolated. He stayed away from everybody.
Yeah. Remember, there are a lot of coronavirus is a cold virus. So, when you've had a cold, you probably had a coronavirus infection or something similar. It just wasn't COVID-19. So all colds are viruses. Many of coronavirus is one of the common ones actually. But COVID-19 is that specific one that can cause problems. And so for even though I think because we're sensitized, we think anyone who had the high fever and the muscle pains and all that, but they could have had influenza A, which is peaks in the February, March time frame. There are other viruses as well that can manifest with the same symptoms. So the thing about COVID-19 that harms patients is it causes acute inflammation in the lungs. It damages the lungs so aggressively that even sometimes when it's really bad, the breathing machines can't oxygenate the patient enough to keep them alive.
Now, see if this is right or not. I don't know. I can't remember. Maybe it was you that told me or somebody else. They're saying that asthma patients actually have a better chance of not contracting it because their lungs are so compromised already that it can't bond to the receptors. Does that make any sense?
Yeah, I have to be honest, I haven't heard that.
Okay.
In fact, I'd worried that anyone with compromised lung function to begin with would be more prone, but there may be another specific reason for asthmatics if that's true. But anyone with chronic lung disease, I actually worry about more because they have less reserve. So if they get a COVID-19 infection that inflames the lungs, there's that
and
would be an
I've
issue.
also heard stories of the ventilator being that if you go on the ventilator, that's it.
Yeah. So we try our best to avoid putting patients on ventilator unless it's absolutely necessary, because the mortality of patients who end up on the breathing machine is super high, and getting them off the ventilator is very difficult. In fact, sometimes they're on the ventilator for like 20, 30, 40 days, in which case you get other ventilator-associated complications like other pneumonias, other infections.
Because now your body's not working for you.
Yeah, and you contract other bugs. So if you need the ventilator, you need the ventilator, because without the breathing machine, if your oxygen levels are too low, you will die. But we know that if you end up on a breathing machine because of a COVID-19 infection, your mortality rate is like 80% or something in that crazy range.
Wow. So avoid the ventilator.
well, no, you don't want to be on the ventilator because of that prognostic thing. But if the issue is if your oxygen level is low, super low, you're gonna die right there and then on the spot. So the ventilator at least gives you a fighting chance.
Yeah. Now, being at the hospitals, how do you find the morale with the nurses and other doctors?
Stress levels are high. Stress levels are high, and people are worried about their families as well, and such. But you know what? I'm so lucky to work with such a great group of people. We all, we put our heads down and put patients first. You know what? We don't even think about that. Or if we think about it, it's in our own private. When we're taking care of patients, that's our focus. So we do a careful job of hand sanitizing, of putting on our proper equipment, and face shields and such is very important. It's very important to protect the eyes too. It's not just enough to have a mask. And so when you're interacting with patients, you need to be in the proper gear, especially patients who have respiratory symptoms. We are wearing the proper protective equipment. It was scary at the point where there was a shortage of supplies, and there still is. It's better, but the supply demand is still a little bit tenuous. But you know what? Our microbiology department, our infectious disease department did a wonderful job triaging patients where you should use full PPE, where you should N95 masks, and where you don't need to.
Gotcha.
And I think that responsible use of our PPE, our personal protective equipment, helped us a lot, and we were able to conserve. And now, hopefully, we're going to be in a lot better shape as time moves on.
Yeah. Do you think the hospitals are ready in case there is a second wave?
Yes.
Like
I think I have to say that you could criticize everyone for the first wave where we didn't move fast enough. I think now we're so sensitized and so monitoring it so closely. We have a good mechanism of tracking patients, and also our testing ability is improved. That I'm very hopeful if we start to see a signal, we can react in a timely fashion.
What do you think about the UFC holding an event and the testing? And I mean, you've worked as a cage-side doctor for the UFC numerous times. How do you feel about that?
You know what? I think they, for their first event, they did as good a job as you can expect. I think people had frequent testing. They required testing before the event for everyone and all officials, athletes and such, during and after the event. I think each individual may have been tested 3 times. And the only thing they forgot, a very basic thing, is to do a proper questionnaire. So Jacare Souza was a fighter on that card, going to be a fighter on that card, who was clearly exposed to his brother-in-law or something who had an active infection. So I don't know how he even got put on the card. He should not even have been put on the card. Thankfully, they swabbed him, and his swab came back positive, and they were able to keep him. But if he was not, if he should have been stopped right at the screening point of the questionnaire.
You're not
because he'd
on
been
the card.
exposed to something and should never have been on the card. Because if he had, the issue is, let's say you have COVID-19 and I'm sitting with you and I acquire it. My swab can be negative. Let's say, I was exposed to you, you have known COVID-19 and I had been exposed to you and they swabbed me and the swab's negative. It can take 2 weeks for the swab to become positive. So I actually should not be, because then if I go and see patients, I could be spreading, even if my initial swab was negative, I could be spreading it everywhere. So you need to quarantine for 14 days and be swabbed, and then you can return to work, as an example. So he had no symptoms, but he had a really bad exposure to a relative, and he should not have been allowed to even come anywhere near any UFC people.
Yeah, because his cornermen all tested positive for it as well.
Yeah. So it spreads like wildfire. It just shows how infective it is, right? That's a major issue.
But he had a asymptomatic.
Yeah, but many people are asymptomatic. But that's the deadly part of it, because that's why the old people die. Because you go visit grandma, and then you transmit the virus unknowingly to a susceptible person.
Because we're golden, we don't. There's nothing wrong
And
with
you
us.
got to remember, though, I don't want to give you. I've seen 40-year-olds die. People in their 30s die who are normal, with no immunosuppression and no immune diseases or anything like that. So young people will die too. Babies have died, and there's a pediatric kind of inflammatory response to get in the lungs now that they're discovering. So even babies who thought were to be protected, who thought were not as prone, they're now seeing cases of even kids getting it. So no one is safe. Certainly, the vast majority of people will just get a cold or nothing and will be fine. But our older patients are very much prone to it, and others can die too. We don't know why some people get a bad immune reaction to it and that attacks the lungs, and others don't.
Yeah, we're pretty. It could be worse. Imagine if it was worse. Imagine if it was like an Ebola.
Yeah, and the interesting thing about those other more deadly viruses, and one is called MERS, which is a Middle Eastern variant of SARS. It had a mortality rate of 30%. That's super high.
That is high.
That's super high, right? Because in kind of with this virus, it's depending on where it's been between mortality rates between 1% and 5%, right? But the issue with those other viruses that are more deadly is they don't seem to be as infective. So that's the difference. So you're right. If this virus was not only infective but also had a high mortality, it would be a horrible thing. We'd lose a third of our population.
Yeah, because it's almost like a good trial run for us to be prepared for something that could be worse.
And you know what? I thought about that, and I think some people have told me the world will never be the same again. Part of me hopes that's not true, because I love our freedom. I love our ability to gather. I love our ability to share ideas, to go to the beach and everyone's out having a good time. So I hope that changes, and I hope that there's an effective vaccine, and I hope that there's an effective way of prevention so we can enjoy the freedoms that we've enjoyed for so long. Because if we start doing everything by Zoom it'll drive me nuts.
I mean, it's affected our charity.
Yes. So as you know,
It's affected everything. I mean, everything has to change.
Yeah.
So we have to roll with the punches and adjust.
Yeah, absolutely. But my hope is that whether it's 1 year from now or 2 years from now, that we can hopefully one day return to.
Do you think it'll be that long?
I'm worried it will be long, but some of it depends on what happens with this pandemic and whether we get an effective vaccine or effective treatments. But I think the repercussions of this pandemic are going to be felt for a few years, for sure.
Now, with the vaccine, let's talk a little bit about that, because there's so many people who say, I ain't getting a vaccine. I don't want to get a vaccine right now. You guys don't know anything about it. There's no studies. There's no this. What if it does that? And coming from a doctor.
Well, I never seem to be able to penetrate the mind of an anti-vaccinator, of someone who's against vaccines. It's just, it seems to be a very difficult thing to do. I can just say that I'm a believer in vaccines, and I think it protects our patients. Certainly as a healthcare worker, I need to be vaccinated against influenza and other things because I never want to transmit those to vulnerable patients. And yeah, some vaccines are more effective than others, but I think it's of significant benefit for our population. And I think especially for a condition like this virus that we're dealing with, it's very important that if we find an effective vaccine that we all try and get vaccinated. I feel strongly about that. That's the only way we can protect our population.
Now, you're recently on a Zoom meeting with Boxing Ontario. Now, what are the steps? Some of these sports, like
yeah. So first of all, I want to give a shout out to all of the gyms out there who I know are suffering, just like all other small business owners. And that's one of the reasons I want to see the economy start to open up, because we need our gyms. We need them
the
to
gyms,
survive.
and I'm super bummed by it, because we deal with the gyms all the time. We're dealing with the fighters. We're dealing with the athletes. And now they don't have that outlet. They don't have that. There's no revenue coming in.
It's horrible. It's horrible.
And they've adapted.
Yeah.
They have adapted slightly.
Slightly, but you can only do so many Zoom workouts, man. It's just so the gyms are suffering. And I feel for all the gym owners, and I wish to send them all my love and wish them for them the best, because right now, Boxing Ontario and WACO Canada and other organizations are starting to develop policies to open the gyms. And Jennifer Huggins, who's the president of Boxing Ontario, put together a committee of experts to try and develop a proper protocol that is in line.
A different type of return to play.
Yeah, that's in line, though, with what public health
Gotcha.
and what the government wants.
Can you speak on that?
Yeah, absolutely. I think in the beginning, really what we're striving to do is, in the first phase, be very, very careful. And this is not probably pleasing to all coaches, because it's not great. But in the beginning, if you're in your gym, maximum of up to 5 people. That includes the coaches. So you can only have up to 5 people in the gym. Before you enter, you have to go through a questionnaire to make sure, be screened for risk factors for having the COVID infection. Then you have to hand sanitize, right? You can't use any of the equipment. There's no communal equipment anymore, so you can't just pick up the gloves and stuff from wherever you want. No sharing of equipment.
Yeah, but sharing gym equipment anyways was always gross.
Oh, it was a bad idea. But now it's forbidden, and some kids can't afford their own equipment.
Yeah.
So that's gone. When you're standing in the gym about to do your workout, you have to be spaced, 2 meters apart minimum, and probably a bit more to give some allowance for movement. Any equipment that is used that's been sterilized before has to be sterilized again. There's specific cleaning requirements of the gym in terms of how you clean the gym and what cleaning agents you can use. And so I think that just that one factor of only having a maximum of 5 people in the gym, how do you run classes that way? And
No
how do
one's
you
going to want to do that.
You have to separate entrance, separate exit, try to minimize contact between people. And I think it's a very responsible way of doing things. Don't get me wrong, but we can't have that. This is my personal opinion. If that goes on too long, the gyms are still going to fold and not be successful. So We need to do it in a staged way. I think it's important to be careful in the first phase, because if you get a resurgence if you get a transmission or you get a COVID positivity that's felt to be from the gym, it could destroy that gym.
Mm-hmm.
So I think, and if you get a second wave and there's any concern that it came from the gyms, we're gonna go back to zero tolerance again, and the gyms are going to be closed again. So I think the first phase, doing it even for a few weeks and making sure it goes smoothly, is good. And I'm hoping and praying that we'll be able to have 10 people and 20 people, gradually increase it as long as we can maintain that social distancing.
But they got to survive that.
Yeah.
The gym's got to survive that long until they get to that point.
And my heart goes out to them. I mean, it's easy for us to make policies, but we're not the people paying the bills, and it's just horrible what I see the gym owners going through, having to sell personal equipment, their own possessions to be able to pay rent for their gym. It's devastating, yeah. So back to your original question of, how much do we have to be careful about COVID-19 at the expense of all these businesses? It's horrible that you even have to make that balance. But I think now's the time we need to start gently opening the economy and closely watching and see how it goes. And we need to help our small business owners now. I think Prime Minister Trudeau and his government and the provincial governments as well have done a much better job than other countries trying to give some financial assistance. Like, they've poured out the money to people who've lost their jobs over this. And I know it's not enough, but it's still more than what other governments have done. And but now that we're seeing a bit better control of the virus, I think we need to start opening the economy.
I think people need to be healthy. People need to build immunity and get strong. I think.
Yeah, I think, again, I do think that the social distancing, the frequent hand washing, the use of hand sanitizer, masking, and I think masks are going to be present for a long time. All of that has helped a lot. Don't touch your face. All of that stuff has helped a lot and will need to continue. But I don't know if, I think being healthy and exercising, keeping yourself in good shape definitely probably helps, but you can't stop a virus from causing an infection, and even in the healthiest of people, it's going to happen. So I think we need to make sure that we continue to do frequent testing, and we don't see a surge in the numbers as we open the economy.
Yeah.
Because all we'll do is, if we are too aggressive about opening the economy, all we'll do is get a second surge and everything will be back to ground zero again. That's what I worry about.
Man, it's scary. But see, I see so many conflicting things online. I mean, and that's why I wanted you to, because I wanted to talk about all these things, because people say, oh, like they're cooking the books. Hospitals are saying when a person dies, let's just say or they had underlying issues, but the cause of death was COVID-19. Like, is there truth to that?
No. So we are
cooking the books, they call it.
Yeah,
to make it look worse than what it is.
So actually, when I get the data every day, I get the data emailed to me about how many COVID patients are in the hospital, and we have three things: COVID positive, so people who are actually COVID positive and have respiratory symptoms; COVID suspect, where they've come in with really suspicious symptoms, but the swab results are not back yet; or COVID negative. Okay. And if you're COVID positive and you end up on a ventilator and you die, that was a COVID-related death. It's clear cut. So we have a very clear way of documenting. We're not cooking the books. If anything, we are underestimating the number of COVID infections because we're only swabbing people who are symptomatic. We're not, for the most part, we are not swabbing asymptomatic people. And initially, we were doing that because we have a shortage of the reagents to run the test. So you know what? So we I think are very conservative, and there's no cooking of the books at all. Right now, thankfully in London, we're doing a lot better. We have very few cases that are admitted to hospital. So we're open with that. It's public knowledge. But there's no cooking of the books, in my opinion.
Now, I saw something that there was a big discovery for a treatment coming out of London. It was out of the kidney department.
Yeah.
Now, can you talk about that?
Yeah, so we're using basically Dr. Chris McIntyre, who's one of our premier researchers, was using a dialysis technology to take blood from the patient, program the white blood cells to attack the virus and then giving the blood back to the patient.
Okay, so then it was a real thing.
Yeah,
because again, you see so many different things.
No, he did that, and so we're really all around the world. There's some really cool research that's being done right now, looking at antiviral medications and such. But we have to be very, very responsible, not do what unfortunately President Trump did in the United States, where he put himself on Plaquenil. So now, which is it's a drug used to treat lupus and arthritis, and has a kind of an anti-malarial property to it. And but there are some signals that it may be beneficial, but really in any sort of trials that have been done, it's not felt to be a benefit, and in fact can make you prone to heart problems. It can make your heart have an abnormal rhythm or stop. So just putting yourself on a drug that people are talking about on the internet is so irresponsible. And for the president of a major country to do that is just dumbfounding to me. So you have to be very careful about buying into new treatments until we have conclusive, good quality randomized controlled trials that at least give us a signal that these drugs are helpful.
Now, the testing for this, how does that work?
So what we do is we do a nasopharyngeal swab. And what that means, we take a small swab, we go through your nose, down to the back of your throat, and we come out very gently. And then we put it in a reagent, and there's a technology that we use called PCR, which amplifies the genetic material from the swab, and then we look for the virus.
Okay, so why do they do the swab as opposed to taking blood work or?
Yeah, so the swab is that you really want to pick up active organism that's replicating in your respiratory system.
Okay.
So the antibody test, which looks to see if you've been exposed in the past, doesn't tell you if you have an active infection. It could mean you could have been exposed 3 years ago or exposed 1 week ago. So really you want to look for actively replicating virus in your system, and that's why the nasopharyngeal swab is the best test to do. The antibody test, which will be the blood test, will be helpful to look if you're immune or not, potentially. So if you have antibodies against COVID-19, you know that you are immune. You were talking about herd immunity. That's how you'd prove it. If everyone had antibodies, that's what a vaccine does. A vaccine, when you inject the vaccine, makes your immune system generate antibodies against the virus.
So potentially injecting you with the virus. So
with a killed version or a modified version of the virus that won't make you sick, but your immune system generates a response to that, and then you have antibodies against the virus. So that blood test is only useful for measuring immunity, if you're immune or not, potentially, but not so much for active infection. For active infection, you actually want to see if you've got the virus in your respiratory system. So we do the swab in, out, put in the reagent, and thankfully in London, they're doing a wonderful job at our lab. We get a result within 24 hours.
Oh, wow. That's good.
Yeah.
Okay. Now, you brought a swab with you today.
Yeah.
Can I see it?
Yeah, absolutely.
Let's talk about it.
So this is what the swab looks like.
It looks scary.
Yeah.
I'm not going to lie. It does look.
So I have a friend who manufactures who kindly gave me one of these. And so the swabs are in here. We use one of the swabs from within this paper container thingy, and then we stick it into your nose, and then we break it off the end off into this reagent, and then we send it to the lab for testing. It takes a couple of just several seconds to do, and that's the way we look for it.
Okay, are we gonna try it?
Yeah, we'll give it a try, bud. I'll show you how it does.
Because I'm just curious because
we won't send it to the lab. There's a shortage of reagents and stuff, but I can do the swab on you, and just to demonstrate for your listeners, what it feels like, and what you can describe what it feels like, and how it's done. And how.
Yeah, I was speaking to you on the phone the other day, and I didn't know that the viruses lived in your nasal cavities. Because I said to you, why don't they just go through the mouth then?
Yeah, no, it's the nasopharynx, which is the junction between the nasal passage and the back of the throat. Is kind of the peak spot to pick it up.
Okay. Now, was it bullshit when they say all these tests came from China and they were infected? Did you ever see that on the news?
No. I mean, that's just bullshit.
That's what I'm saying. Like, there's so much stuff, and you're like, oh, geez.
This is not a conspiracy theory. The China did not make this virus as a biological weapon. Please stop looking and reading that stuff.
It wasn't done from a 5G tower.
No. And this is an unfortunate thing that happened. It happened 100 years ago. It's happened intermittently with different viruses. Actually, we've had pandemics involving a variety of different organisms. And it's horrible when it happens. Because
I guess there was a pandemic during Woodstock.
In 1969?
Mhm.
I'm not aware of that one.
Yeah, hopefully it's not false, right? Because there's so much stuff. But I actually
1969, there was a lot of syphilis and gonorrhea and chlamydia. That might have been the pandemic you're
everybody
referring
was
to.
doing each other. That's the problem. But I did see that they were in the middle of a pandemic during Woodstock.
Yeah, I think the last major pandemic, I'm not a medical historian, was in the 1920s, and it may have been the swine flu or something like that. Again, another kind of viral infection. So pandemics happen, and this is not a conspiracy theory. This is not somebody making the virus to harm the world. This is very unfortunate. Everyone has suffered from this. They're not. Nobody wants to see this happen. Nobody wants to see their economy go down. So I'm sorry. Those conspiracy theories are just ridiculous.
Because I can't even believe that we're in the middle of a pandemic to begin with, and that we're on quarantine already. So when you see stuff like that, that's your whole world twists.
Yeah,
overnight.
And 100%. Like, don't get me wrong. I sit down sometimes and look at at the end of the day, I'll be sitting. I was like, what the hell is going on? Like I never would have thought this would happen in my lifetime. Right? We feel invincible. Life is good. You don't. But. There's a few things we can't change. We can't change environmental catastrophes, which happen and are very deadly, and we can't change. It's kind of the environment too, but health-related things that happen and weird infections. And HIV came out was first discovered in the early '80s, late '70s, early '80s. Well, that was horrible time for many of our citizens, right? And so, new diseases crop up, weird viruses crop up. Some of them originate in animals and then carry over to humans, but it's nobody's fault. Like, it's nobody's fault. And I think what I don't want to see is the racism, for example, that we're seeing directed against people who are of Asian background, for example. It just drives me nuts. This is not any one country's or any one person's fault. Nobody wanted this to happen.
Yeah, it's. Definitely, 2020's been a shitty year, man. I thought it was gonna be like a.
Well, it's been a shitty year. I have to say, this is only from a personal view. I mean, that I have enjoyed the time, spending more time with the family and more time kind of valuing a bit of a slowing of the pace. Valuing eating local. Like supporting our local farmers, people who make local
I put a lot more emphasis in that as well.
So supporting local
as much, and I always have anyways. But I kind of go out of my way now.
It's super important. So I see people coming together from that. I see families gelling. But don't get me wrong, I miss a lot of the other things that we had before. But I think this has allowed some of us to slow our pace down a bit. And rethink.
I've been doing gardening.
Yeah,
I've never had time before. I was, I had fights coming up, or I was like super busy. But now all of a sudden, I'm doing all the things that I couldn't do before.
Yeah,
which is a positive spin on it. I've been able to spend more time with my daughter and my wife. And just not being go all the time. Yeah,
100%. So there have been a few positives for sure. I think my heart always goes out to the small business owners, though, because they are who make us. They make our lives better. They provide us with services that are amazing, provide us with escapes from, to get away from the stressful existence that we have. So, the restaurant owners, the gym owners, the dry cleaners, everyone, they need our help now. And so I think, like you said, we need to do a responsible opening of the economy. And if it goes smoothly, we can expand that and hopefully start to try and return back to normal.
It bums me out, man, because we had that charity event planned in September.
Yeah, so, it's funny. I don't think anyone was more bummed out than me. And when you came to speak to me about the showdown in the downtown, we were going to do a big pro MMA event at Budweiser Gardens. We'd paid the down payment. Everything was good to go for September 26th. But you came to me, actually. And you said, Faisal, what are you doing? Like, what? Oh, I'm going to cancel. And I said, what are you doing? We need to keep it going. We need to help the charities. Why don't we we should be thinking of a virtual concert or something like that. And so you really got me thinking and excited about it. and so hopefully we'll be able to pull off a virtual concert with a pretty good act.
Yeah, and that's the thing is obviously I'm bummed that there's no fights. I want to put on a big show, and Budweiser Gardens, another favorite venue of mine.
Yeah,
And
beautiful venue.
But the charity can't miss a year from it.
Yeah, I
We can
appreciate
improvise
it.
and do something
Honestly,
else,
you were
right?
my main motivation to coming out of that funk. And then Lindsay Manns, who works at the Hospital Foundation, was also very encouraging. And so, thanks to you, I think we're going to hopefully get a good rock and roll act. We haven't signed the deal yet, but to perform on September the 26th. And it'll be a free concert for people to view, and people can donate if they want to, and we're going to support some awesome charities.
Yeah, because I've been, and I think we're going to add the COVID relief fund to that somehow.
Yeah, so there's COVID research it helps support COVID research, but we have a lot of cool things. We have a Down syndrome boxing program that helps uplift kids with developmental disabilities.
I saw that. That's the newest one. Tell me a little bit about that.
Yeah, so there's a national champion boxer by the name of Tavina Koom who has dedicated her life to helping train our citizens who suffering from Down syndrome, Asperger's, attention deficit hyperactivity disorder, fetal alcohol syndrome, and other special needs kids, and has used boxing to help uplift them physically and emotionally.
That's great.
And it's an amazing program she runs, but it's in huge need of funding. So we're going to raise money for that. We're going to raise money for the research unit at Marymount that helps children whose parents can't take care of them anymore and provides them with a bed and a place to stay and live and some social supports. We're going to support seizure research, epilepsy research, kidney research, heart transplant research. We've got several charities that are going to benefit, that have benefited over the years. So I'm really, really excited about that. But yeah, the Down syndrome program is very dear to me now. And so, I'm very happy that we can support that.
Yeah, so we got some work to do.
Yeah,
right? So
we got to get
and we haven't had a meeting.
No, but we're going to have one soon.
Yeah, so I think the next one we'll do a Zoom meeting.
Yeah,
is the plan, and then we can game plan how we're going to roll this out. I'm excited to get back to work on something because I feel like like I'm lazy.
Well,
like
no,
I got nothing to do.
I think Jamie, I think you miss what you're passionate about, which is helping the community, organizing awesome fight events, which you always have, and so hopefully that will return soon. I just don't know. I don't have a feel for when they will allow us to have big fight events with 2,000, 3,000, 4,000 people in a venue. I don't know. The London Knights, even if you're a hockey fan, when will they allow spectators to return? Nobody knows. So I think we really have to see how things roll out over the next few months.
Yeah, because I've even floated the idea of doing an event, kind of like the UFC style, but with no crowd, just filming it, because I went panic mode. I'm like, okay, what can I do now? How can I improvise it?
Yeah, and the UFC events were really good, but man, I miss the crowd.
The crowd is everything.
Oh God,
the
whole atmosphere is like incredible, right? But it was still very well run, and I would still watch. And
I do like the sound better. I like watching when a guy gets punched in the face and you can really hear the thud. Yeah, you're like, oh, and hearing the cornerman.
Yeah,
I do like that too. I actually don't like watching fights at a bar.
Yeah,
because I can't hear the.
You can't hear anything.
I can't hear anything. I want to hear everything.
I have to say, I love the Tony Ferguson Gaethje fight.
What a great fight!
And even though there was no crowd there, I have to say I was completely mesmerized. And you're right. But still not the same.
No, you need the roar. You need the drunken assholes yelling, elbow him, when it's like there's no position to elbow. But that stuff makes the event.
Yeah.
It makes it's the energy levels. When you see somebody crying because they saw someone they love so much lose, or you see someone celebrating because they just watched their husband win, or you know what I mean. So. Yeah. I just want to get back to it, man.
Yeah, well, you know what? Well, hopefully soon. Hopefully soon.
Are we going to do this test or what?
Yeah. So
I'm
let's
nervous
get it done.
as hell.
Let's get it done.
Time for questions, another test.
Yeah.
Facebook questions.
Oh, is there more Facebook questions? Yeah. What do we got there?
So the first one's from Lauren Maharaj.
Yeah.
And she says, can Faisal share a step-by-step look at what a combat sports event will now look like from a doctor's perspective, before and after the vaccine?
Shout out to Lauren.
Yeah. So Lauren, great question, and I wish I had a good, well thought out answer for you. I think in the short term, it's kind of going to be what we talked about, which is just for the gym's perspective, just for gyms to reopen, it's going to be a very, very slow process, and this is both the professional gyms and the amateur gyms, in my opinion, because it's going to be so hard to train with social distancing rules as they are right now, and limited use of equipment. It's going to be tough, and I think if somebody tried to hold a combat sports event right now, whether it be amateur or professional, they would be forced to do it in a situation where you would need to have adequate access to this testing with results before, during, and after the event, and you would need to have basically only a limited number of officials and nobody in the crowd. And so you would have to do what Jamie's done for some of his events, which is use pay-per-view, at whatever rate you want, with $5, $10 or more, where people could watch the fights on pay-per-view. And then, but to be able to do that, to do all of that swabbing, right now we have limited ability to get the reagents and to do the tests and the volumes that we want to do right now. That'll improve though, but unless you're a big promotion like in the UFC, I don't see the promoters that we have right now being able to organize all of that testing.
And that's the thing. And I did think about it. Like I said, when I had said, well, maybe we do it, no crowd, you do this. The problem is nobody's training.
Yeah.
The problem is the commission's not open.
Yeah.
The problem is how are you going to get licensed and blood work and all like.
Yeah, and that's in Canada. Now, Lauren, as you know, in the States, the rules are a bit more lax.
Mm-hmm.
So a lot of the pro fighters in the States are training. And
they don't have rigorous testing like we do here as much.
So
depending on
the
state.
UFC does.
Mm-hmm.
So that's why they were able to pull it off. But I'm just saying, even for training,
Mm-hmm.
the gyms here are not as accessible as they are in the States because they've opened the economy very fast over there.
Mm-hmm.
But saying that, if you wanted to run a pro event now in Canada, I think it would be super difficult. Now, 3 months from now, if we're able to increase the number of people that are able to be in an enclosed space and increase that to 20 or 50 people, then yeah, you can run an event. But again, no crowd, just the officials, just the athletes, and pre and post bout testing is going to have to be in place. And promoters in Canada already are not able to generate lots of profit. Mm-hmm. No matter how hard they try in boxing or kickboxing, it's a struggle. So this is going to really hurt them, and they're going to have to depend on having a pay-per-view setup, which you can do,
Mm-hmm.
for people to be able to watch the fights online.
Mm-hmm. What other questions we got?
Yeah, I got another question from Trevor Airdrie.
Trevor Airdrie.
So he asked if you think fights should be going on during COVID-19, the risk that places like Texas allowing 50% live attendance will have.
Yeah, so would I want to see that in our own community? I'd be nervous about it for sure, especially when you can have that many people from the general public who presumably are not going to be tested. If anything, I hate to say this, but it'll be a good experiment because the United States is taking these risks. And if it's going to cause substantial problems with this viral infection, we'll know pretty quickly. Mm-hmm. There may be a delay of 2 to 4 weeks, but you will see a surge in the number of infections. So it would make me nervous. The problem is we don't have great guidance in terms of how to properly open the economy, and the same goes for fight events. We don't, and we're making it up as we go. But I personally do think we should err on the side of caution and do it in a very graduated way. So that if we do get that second spike in cases, we pick it up early and we can deal with it, as opposed to what happened in Toronto when they opened up the park and tens of thousands of people showed up. That's not what you want, because if you get a spike from that, it's going to be lots of patients. I don't think people realize that in Italy and other countries where this virus hit hard, the devastation it caused. There were people dying that couldn't get a bed in the hospital because there were too many patients. Mm-hmm. And they were dying because there were not enough breathing machines to go around.
See, China locked theirs down really, really fast. Whether they say the numbers are true or not, we don't know. I've seen that too. they're saying that they lied about the numbers. But if you look at their cases of active cases and then cured, like they shut everything down.
Yeah, I mean,
You couldn't go anywhere. They were locking people in their houses.
yeah, and it's a horrible thing to have your freedom taken away, but I think that was effective in controlling it.
I think that's the only way to do it.
Remember, the United States has more deaths than China.
Mhm.
Remember that.
Yeah.
And there's a reason for that.
Mhm.
So, I think the actions that we took, even though they hurt so many people and economically, probably saved countless lives.
Mm-hmm. Yeah, I just we got to get through this whole thing, man.
Yeah, but I think now let's open the economy. Let's do it in a responsible way, in a graduated way, and hopefully, kind of what Lauren and Trevor's questions are, that we will be able to have fight events. But I'm just being super honest. I don't see it happening in the near future. If they do even happen, I don't see a substantial audience. I see a pay-per-view type program. And the reason I don't see any of that is I don't see promoters making money unless you get a TV deal with a big U.S. company that'll air your fights and they'll pay you to produce an event. That might work, but I don't see a lot of that happening.
That's tough.
Yeah.
It's not. It doesn't come out easily.
Yeah.
One more question. This one's actually from me. But for you specifically, with your career being a fight doctor and probably often having to go down to Vegas and the States, how has all this kind of impacted you? Obviously, you can't cross the borders right now, but how do you see that with the fight side of your career?
Yeah. So the interesting thing is I'm only licensed to be a ringside physician in Ontario. So my license doesn't go outside of here. I've attended events in Vegas and I've gotten to sit with the officials there because they know me and they get me a spot and stuff like that. But I've never been a ringside doctor outside of Ontario. So how this affects me is, honestly, I won't be a ringside physician this year or potentially or for the foreseeable future until the economy opens up more. And I miss it. I love being able to work with the athletes. I love being able to help with their medical needs during the events and such, and even before the events. The other thing that's how it's going to impact me is it's hard to get anyone seen in the hospital right now. There's a limit to the number of outpatients we can see. So I used to do many fighters' medicals in my office at the hospital, and I'd help do all of that and help with organizing the testing. I can't do that anymore because all of that testing is closed off except for urgent medical needs. So to get an EEG and an MRI and ECG and chest X-ray and all the other medical requirements of blood work, I can't be bringing people into the hospital because we have, some COVID-19 infected patients, and we're trying to limit accessibility. So it's actually going to hurt my ability to help athletes get licensed.
We're good. We're gonna do this test.
Yeah,
I'm nervous about it. I'm not gonna lie, but I think.
Let's get it done, buddy. I think it'll show you how quick it is, and it's relatively easy. But you'll actually be able to share with your audience.
Well, that's what I would
how
like
it made
to do.
you feel.
I would like to look at it, and maybe it's not as fearful as.
Yeah, I mean, it's a quick test, and obviously the information can be very important for protecting both you. And I mean, having a COVID-19 positive test is not the end of the world either, right? It just tells you, what, you've got it. You need to hang out for 2 weeks, just take it easy, and you're going to prevent the infection of other people. So, the fact that it was picked up is a good thing for society and for yourself because you can be monitored. And as I mentioned, the vast majority of people who do get the COVID-19 infection get better. So it's not a bad thing, and it's very important to know it so that you don't infect your loved ones around you.
Right.
Yeah.
Okay.
Get it done, bud?
Yeah, let's do it.
All right.
Okay. So for those listening and anyone that's not watching, most are listeners. Dr. Faisal right now is putting on. You can take those headphones off, okay? He's putting a protective mask with an eye shield, which he brought. Everything's been sterilized. He's got the proper PPE and reusable PPE is what he has today. So he's just gearing up to plunge this thing right into the depths of my brain, implanting the microchip for tracking. Let's hope I don't throw up everywhere. It hits that gag reflex, and all of a sudden I get projectile vomit. He's putting on gloves.
Yeah, no, it's not that bad.
I remember I stuck my finger in my nose too far one time. No bueno.
All right, my son. Are you ready?
I'm ready.
You're gonna be
Can you
standing.
tie tie the back?
Sure.
Oh, sorry.
for sure.
I need some assistance.
What I'm gonna do is I'm gonna
We need
for a sec. I have to feel like a nurse for a minute.
Hey?
You guys can edit this too, right?
So tie.
Don't be nervous, my son.
Oh no, I'm okay. I'm good. I trust my king. I trust you.
Well, I
trust
wouldn't trust me, but just don't be too nervous.
Did you say not to trust you?
Yeah.
Oh, great.
So
Here we go.
Is the camera rolling?
The camera's rolling.
Camera's rolling.
We're rolling.
Each kit comes with 2 swabs. We do not use this one. We use this one with the brush at the end of it. Okay. And then I approach the patient.
Okay.
I get them to. So what I will do is gently introduce this. Want me to close your eyes, just relax, and let me put it in all the way. So I'll just very, 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 very gentle, going really slow. Sorry, Jamie. It's okay. It's okay. Just turn it around, and it's all done. And what I do is I
Whoa.
take this here, and I place this in the medium, and I break off the end. Put that in there, seal it, and then this goes to the lab, and they do that PCR test on it.
Okay.
How would you describe that test?
It wasn't bad actually. It was just a minor. It was more of a tickle.
Yeah.
So it made me want to sneeze.
Yeah.
So it's more
But
like
it does make you tear up a little bit.
Oh, for sure. With anything, with the
yeah,
nose.
Yeah.
You okay?
So so that's it, and then we send that to the lab for PCR, and you get a test result back in about
Okay.
24 hours.
Yeah, that wasn't bad at all. I was actually I was nervous about it because when we talked about it on the phone, I was like, oh, okay, let's try it just
Right.
to just to kind of go through the motions to see what someone would have to go through to get tested.
yeah.
And actually, all it did was just make my eyes water.
Yeah.
And then gave me that tickle and the sensation of wanting to sneeze.
Yeah.
So like, right, I'm dying. I want to blow my nose right now.
Yeah,
That's about it.
That's about it. Yeah.
But ultimately, not a big deal
Yeah,
at all.
no, but yeah, and it's so helpful to get it done and diagnose our patients in a timely fashion, isolate them, and protect our other citizens.
Yeah. Yeah, that wasn't so bad. I was a little bit nervous. Yeah. Okay, let's wrap this up. Faisal, thank you so much.
No, thank you for having me. It's
know-
always great to be on your podcast, and hopefully we can get working on our charity work soon and
Yes.
get something going, right?
Back in business
Awesome.
and up and fully running. And thank you for your insight. Ladies and gentlemen, King Faisal Rehman.
Thanks, guys. Appreciate
Thank
it.
you.
Take care.
I'd like to take this opportunity to thank my sponsor, Rycor Countertops. They deal in custom countertops in quartz,